this guy's garage. Like and subscribe.
One of the things we say in medicine is primum non nocere, above all do no harm. Perhaps you could table, actually not perhaps, we'd like you to table the data from which your government draws its information to tell us and Canadians when you're going to end this dangerous experiment.
I thank the member for his question. As he's aware, and I'm happy to table here, all data of our programs and the evidence that we have collected from our SUAP projects and other interventions are available on our website. We're happy to table them here. I'm not really sure what you're referring to in terms of an experiment. If the colleague could clarify, please.
Yeah, thanks very much, Minister. I appreciate that, because those were the words of Dr. Hanley, that this is an experiment. That's the original motion here, that the decriminalization of drugs that you're doing hand in glove with BC and the so-called safer supply is an experiment. So could you actually table with this committee the official government data to show that the so-called safe supply saves lives?
So the BC dashboard is available with all of the evidence collected today within the first year of the pilot. We're actually coming to the first year anniversary since the BC government requested the exemption on decriminalization of personal possession. All of that data is available and we're happy to table it. However, as the colleague well knows, this is a 3-year pilot program.
Clearly, Minister, we know that the number of deaths every day is going up, now stands at about 22 across our great country. When will you end this dangerous experiment?
The question is, how will we continue to save lives? That is my answer to when we will.
I'm sorry,
we
Minister,
will not stop providing
but I'm going to interrupt you there, because my question was, 22 people are dying every day. That's increasing. Everybody here knows it. Everybody across the country knows it. That is getting worse. When will you decide to end the dangerous experiment?
My answer will be that we will never stop providing medical health care services and interventions to those who use drugs and substances. Every life loss is one too many.
Excuse me, are you suggesting that the so-called safe supply is a medically necessary and a medically proven therapy?
Suggesting that the entire comprehensive approach of a continuum of care, which includes a wide range of medical health services and interventions, is something that we are fully committed to save lives in this country.
So, Minister, I guess what I hear you saying, and correct me if I'm wrong, but is there any evidence that could possibly exist that would make you end your dangerous experiment? Even though the numbers are getting worse every year, you're not stopping it. You're telling us it's going to go on for 3 years. Is there anything that's going to make you stop the dangerous experiment? You're harming people.
The reality today is that the illegal toxic drug supply is pervasive and deadly, and I do not see any government stopping in its efforts to save lives from what is such a dangerous and pervasive illegal distribution of drugs across this country.
Minister, even though you know it's harming people from the studies that are out there, science, that you're going to continue that harm. That's what you're telling Canadians.
Evidence of overdoses today shows that the majority of overdose deaths are from the illegal toxic drug supply, and we will continue to fight and save lives.
Minister, just a little demonstration. We talked about decriminalization. This is not drugs. This is actually sugar. This is 2.5 grams. Realistically, the density is about the same as fentanyl. For Canadians out there to understand that this is 2.5 grams. And we also know very clearly that from...
Point of order.
Ms. Atwin, on a point of order.
Thank you, Mr. Chair. I'm just wondering about the use of props in committees. If you could rule on that, please.
Okay.
This isn't the House.
It is not.
Okay. I'm advised that the rules regarding the prohibition of props also apply to committee, so I would ask you to refrain from that, Dr. Ellis. Thank you.
Well, I certainly would like to challenge the chair on that, Chair. I mean, this is absolutely ridiculous. We know that from many other committees, props are more than happy to be allowed in every other committee. I've been at Natural Resource, National Defense last night, Natural Resources early on in the week this week. Props were used, and this is an absolute travesty. We know that simple allowance to use props in committee has been something that has happened across a multitude of committees, many that I just named, and your ruling, sir, is absolutely incorrect.
Well, so it's a non-debatable motion, a challenge of the chair. So the question for the committee is whether the ruling of the chair shall be sustained. So the ruling that I made was that we are not going to allow props today, or ever. Please conduct the vote, Madam Clerk.
Ms. Atwin?
Sustain.
Mr. Hanley?
Sustain.
Mr. Juari?
Sustain.
Mr. Pulowski?
Sustain.
Ms. Sidhu?
Sustain.
Mr. Ellis?
Against.
Mr. Kitchen?
Against.
Ms. Goodridge?
Against.
Mr. Majumdar?
Against.
Madame Larouche?
Pour.
Mr. Johns?
Sustain.
Seven yeas, 4 nays.
The ruling of the chair is sustained. Dr. Ellis, you have 2 minutes and 18
Point of order.
seconds. Point of order from Dr. Kitchen.
Point of order. Mr. Chair, can you provide for this committee the actual ruling of your ruling, exactly showing us where it says in the books and in the orders that that's exact for committees, please?
Dr. Ellis, 2 minutes and 18 seconds.
Well, thank you, Chair. You know what? And it's interesting that during this committee, we know very clearly that from the Canada.ca website, a few grains can kill you. And we know that that's true. And that would be simply a small amount of sugar if there happened to be any on my desk. A very tiny amount. And I guess the question is, do you think that that is appropriate, Minister, that now we're going to prescribe that to children?
I believe the colleague's question was also asked during a previous committee meeting to one of the officials, and what I'll say is that the decriminalization pilot is, first of all, anchored in reducing the level of stigma of those who use drugs to ensure that they get to treatment and access and care.
But is giving giving very potent opioids to children, of which the Canada.ca website says very clearly a few grains can kill you. Is that appropriate?
So, Mr. Chair, my colleague did ask this question before, and I believe we've already tabled all the proofs on safer supply, and I'll be happy to table them again for further reference.
That's not the question, Minister. My question is do you think you should be giving an incredibly potent synthetic opioid, of which a few grains can kill you, to children? Yes or no? Simple.
Each physician works with their patient on the treatment protocols that work best for them. That is a very unique and important relationship that
Thank you
every
very much,
patient should
Minister. I
have.
appreciate that. Doctor-prescribed opioids are being sold on the streets. A Global News reporter was able to buy 26 tablets of hydromorphone in East Vancouver from the so-called government, taxpayer-funded safe supply. Total price $30, about $1 a pill. When you saw that report, what did you do, Minister?
I'm aware of the concerns about diversion. I've said it in this committee before, and I will say it again. Diversion is illegal.
What action did you take? What did you do?
I'm happy to answer, Chair, if I'm not interrupted.
Yes,
Thank
please,
you.
please go ahead.
Since I'm aware of the physician's letter, I've actually met with the expert physicians who submitted the letter to me, and we also conducted a roundtable discussion with them, with department officials on January 30th, and we continue to consult with them on ensuring that we safeguard prescriber interventions that are safe.
So, Minister,
Thank you.
what I heard you say is you had a couple of meetings and actually did nothing about it. Well done.
Thank you, Mr. Chair. Minister, you're a mom, I'm a mom, and recently in BC, protocols have been put in place to allow so-called safe supply of fentanyl to kids under 18 without parental consent or knowledge. My question is simple. Have you met with the Prime Minister to put a stop to this?
I think the more important question is to meet with the experts who are involved in the prescriber intervention models that you discussed, because they are truly the experts in this field, which is something that we have done. And like yourself, I am a mother.
Have you met with the Prime Minister, yes or no?
I meet with the Prime Minister regularly.
Have you met with the Prime Minister to discuss fentanyl to children under 18 and putting an end to it, yes or no?
The question should be asked is, meeting with experts and physicians who are responsible for prescriber models to their patients. Medical
You're
practitioners
okay
and
with children under 18 getting fentanyl
the question was
prescribed?
whether or not I met with the Prime Minister. That was not, the
Okay,
question was not
then
whether or not.
Are you okay with children under 18 being prescribed fentanyl, yes or no?
I am comfortable with medical practitioners meeting with their patients.
Okay,
to
thank you,
understand
Minister.
what is best
So
for their
on,
patients.
on September 26th in question period, you said decriminalization was the first step. What's the second step?
Harm reduction. There is prevention, there is harm reduction.
Okay,
There
thank
is
you.
treatment and recovery.
So have you had any conversations about legalizing drugs like heroin, cocaine, and meth?
The decriminalization program is not about legalizing illicit drugs. The decriminalization program pilot project that was requested by the BC government is about reducing stigma, those who are in personal possession, to be able to access medical
Okay, thank
services
you.
and interventions.
So what is your stance on publicly traded companies like Safe Supply Streaming Company and Lucy Scientific, who are selling stock based on what they seem to predict as a legal market in Canada for drugs like heroin, cocaine, and meth?
I don't work in hypotheticals. I work in the realities of this moment.
This
and
is
in
the reality.
realities of this moment are that the interventions that we work with the BC government and with many jurisdictions across the country on based on prescriber-based interventions. If the market
Minister?
wishes to speculate, that is the market's choice.
Minister?
We are fully committed to
Please.
a prescriber model.
Go ahead, Ms. Goodrich.
So are you committed to no more legalization of hard drugs in
We have
Canada?
not legalized hard drugs.
Will you? Yeah, you have. You legalized marijuana since forming government in the last 8 years. My question becomes: are you looking to legalize more drugs? Yes or no?
We have not legalized illicit drugs.
Okay. So, Minister, I know we've had conversations.
Chair, do I have another moment to answer on that?
No,
No? Okay, thank you.
go ahead, Ms. Goodrich.
What my colleague was trying to show earlier with the fact that a few grams could kill somebody with fentanyl, and yet you've allowed a decriminalization pilot project to allow up to 2.5 grams, which most Canadians aren't familiar with grams because we don't do our baking or our measuring in grams. It's a lot. It's a lot more than a couple grams. And so it's terrifying that we are allowing people to just have free will on this. When I asked your predecessor at committee, what would it take to stop the decriminalization pilot project, this experiment on our society? She said very clearly, both on the public health indicators and the public safety indicators. What we're seeing is out of control crime and chaos on our streets and increase in overdose deaths. And yet you very clearly said that you are A-OK continuing on with this decriminalization pilot project. Is there anything that could happen that would make you stop?
Okay, now, Minister, you have a full minute without being interrupted. Go ahead.
Thank you, Chair. So I'll start by saying the 3-year pilot exemption that was asked for by the BC government was put forward after extensive consultation, including of the amount of 2.5 cumulative threshold. And I would note that while it was approved by Health Canada, it was supported in full by the Canadian Association of Chiefs of Police. So this wasn't done without consultation. It wasn't done without careful consideration. But I would also note the composition of the drug supply at this time is changing. It's deadly, and the substances that are in it are frequently unknown even to those who use them. So to posit that it's specifically one drug in that 2.5 is really not facing the reality of what's on the streets that is so deadly to those who are using them.
Thank you, Minister, and thank you, Ms.
Well, thank you, Chair. You know, Minister, it's pretty clear what we've heard. You're okay giving fentanyl to kids without parental consent, and you will not rule out the legalization of other drugs like cocaine. Have you read this study from the British Medical Journal talking about mitigation guidance on opioid and stimulant dispensations? Just came out in January.
No, I have not read it.
Right. It's interesting because my colleague, Mr. Johns, referenced it, and clearly he presented the biased option, which sadly misuses the study and doesn't talk about the opioid agonist therapy, which exists inside the study but is not talked about inside the study. we're firm believers on this side of the house that opioid agonist therapy and rehabilitation is the way to go. What we're having a trouble with, and what you've clearly failed to see, is the difficulties associated with your so-called safe supply that is actually harming people. So the question is when will you read this study, and when will you take actual science and the criticisms of this paper into account when you're making your policies?
Mr. Chair, we do have an expert in the room here on research and evidence and peer-reviewed reports, so I'm going to turn it to Dr. Sam Weiss, if I may, to answer Dr. Ellis.
Thank you very much. The study that has been referred to from the British Medical Journal, published in January, was funded by the Canadian Institutes of Health Research, and we're very proud of the important work.
Excuse me, sir. I realize that I asked the minister the question, but get to your point. I guess the question is, I don't care who did it. Have you read it? And do you know the criticisms of that paper?
Yes, I have. And I know. And
when are you going to take into account the criticisms for that paper when you're creating your policy on your so-called safer supply?
Right, so I don't create policy. I'm a researcher. But
thank you very much. I don't need an answer from you then. That's very good, because the person who's signing off on the policy isn't reading the paper and clearly is not getting good advice. So I'll turn the time over to my colleague, Ms. Goodridge.
Thank you. What is your stance, and do you believe that drug users should be able to use drugs in children's playgrounds?
We signed an exemption at the request of the BC government, an amendment, my apologies, in September with regards to playgrounds.
So you don't think that drug users should be allowed to use drugs in children's playgrounds?
I believe that in addressing the opioid crisis and the overdose, the level of overdoses that we're seeing, that we need to have a clear anchor both in public health and public safety.
I'm asking a really simple question. So yes or no, should drug users be allowed to use drugs in a children's playground?
We signed an amendment at the request of the BC government in terms of demarking public use with regards to playgrounds, splash pads, and other public areas.
Do you believe that recovery from addiction is possible?
I think that everyone's journey is unique and that recovery is possible for those, but it often, in many cases, the evidence shows that it takes more than one try.
Do you believe that we should have a recovery-oriented system of care in place in Canada?
I believe we need a full suite of services and a continuum of care that includes prevention, harm reduction, treatment.
Do you think it should be easier for people that struggle with addiction to access treatment than drugs?
I think that an individual who struggles with substance use should have the lowest access barriers to get help and medical services.
So do you believe that people that struggle with addiction should have easier access to treatment and supports that help them get to treatment than drugs?
That they should have the lowest barrier access to all medical services and supports that can help them with their substance use towards recovery.
So do you believe that we should start restricting the amount of drugs available on the streets so as to reduce the number of new addictions?
That would be with regards to enforcement on the illegal toxic drug supply. Is that what you're referencing?
Well, I'm wondering, because what we have been seeing is so many stories coming out about the diversion. There are facts and stats coming out about drugs being diverted from safe supply programs getting into the hands of kids. So I'm wondering if you think that we should be far more strict. If you're going to continue allowing drugs to just be flooded into the streets, do you think there should be witness programs? Do you think that there should be spaces so that they cannot just carry those with them and potentially sell them to kids at playgrounds?
In my answers to Ms. Atwin earlier, so they are on the record, we talked about the extensive mitigation steps that we have taken with those safer supply programs to ensure diversion is mitigated as much as possible. As I said, diversion is illegal in this country and continues to be so.
It's still happening. Drug use is illegal. It's still happening.
It is.
And so my questions are very pertinent. And frankly, I don't want to see so-called safe supply at kids' playgrounds. That should never happen, and yet we see it. We see it day and day and day.